All right, good afternoon, everyone. And I want to thank you all for joining us for the fifth in our ongoing series of informational sessions for our MSCs. I want to just point out before we get started today, can you go to the next slide for me, our next session, because we always like to let you know what's coming up. On the 28th of the month, we'll have a session dedicated to what you need to know to help the individuals you support transition to the care coordination health home and health home care management. So that is one that you won't want to miss. The registration information is on the slide. And as you also know, all of our sessions are recorded and placed on the OPWDD website for viewing later on. And viewing of these webinars also counts toward your ongoing education credit for MSC. So we like to point that out as well. Our goal in doing these webinars is to help facilitate this transition for obviously the people who are receiving services, but also for all of you MSCs who are so important to this transition and to our system as a whole. So today, I'm very pleased with the presenters that we have from the New York Association of Emerging and Multicultural Providers. We at OPW have been working as best we can with the CCOs and now also with our colleagues from NIAMP to help determine what you need to know to go from being an MSC to an effective care manager in the health homes that are ahead of us. So our colleagues today from NIAMP who are joining us are a tremendous team that know a great deal. They have been the ones who created a training guide for CCOs to help educate you on what you need to know. And we've asked them to come here today to go into some of the details with you as the MSCs to help just shed some light on this and what you can expect going forward. So today we're joined by Yvette Watts, the Executive Director of NIAMP, as well as a fabulous team, Drs. Elizabeth Corrigan and Dr. Gilbert Lewis. And our key presenter is Noelia Mango, also from NIAMP, who's going to be leading us through the presentation today on the title that you see on your screen. At the end, we'll have questions, and all or some of them may be able to help answer those questions for you. So with much appreciation, I'm going to turn it over to Noelia and just thank you for coming today, and go ahead and lead us off.
Thank you, Diane. Good afternoon, everyone. My name is Noelia Mango. Thank you for having me. I am a consultant for the New York Association of Emerging and Multicultural Providers, or NIAMP. The NIAMP team, in collaboration with OPWDD and the Department of Health, has written OPWDD's upcoming training guide for care managers for use by the Care Coordination Organization Health Homes, or CCOHH. The training guide for care managers was written as part of OPWDD's transition into the Health Home Care Management Service Model. The Health Home Care Management Service Model is currently being tailored to serve individuals with intellectual and developmental disabilities through Care Coordination Organization Health Homes. This significant initiative is an important step to transition the OPWDD system to managed care. Now, a key to having a successful CCOHH program is a robust and highly skilled workforce made possible by effective and continuous training. CCOs will use the upcoming training guide for care managers as a critical component to develop training curricula and presentations to ensure a well-trained and responsive care manager workforce. The goal of today's session is to highlight what will be changing and what will not during the transition to care management. And we also want to introduce you to the training guide, its 10 skill building areas, and the learning objectives for care managers. Approximately 3,000 MSCs will transition to a care manager's role. And we'll begin today's discussion by understanding why our current system needs to transform to care management. Here, we'll also talk about grandfathering MSCs into care managers and what MSC responsibilities will remain unchanged. In the training guide for care managers, there are 10 skill building areas, and each has a set of learning objectives. I will show you the 10 skill building areas, and I'll give you a sample of what the learning objectives look like under each skill building area. We'll finish by discussing OPWDD trainings that are already in place and that speak to the 10 skill building areas. We'll also talk about upcoming trainings that are in development. And as Diane said, once the presentation is over, OPWDD and the NIAMP team will take your questions. So let's talk about why our system needs to transform. The current system allows agencies that provide MSC services to also provide waiver services, and CMS has determined that this arrangement currently does not meet their definition of conflict-free care management. So to comply with the conflict-free federal standards, OPWDD has begun developing care coordination organizations, or CCOs. CCOs will be the not-for-profit entities responsible for care management services. Care management services are defined by the 6 health home core services that we'll discuss shortly. Now, because CCOs will be solely responsible for care management services, CCOs will not provide waiver services and thus avoid any potential conflict of interest. Through this new arrangement, there will be certainty that the care manager works exclusively for the individuals and their families' interests. The new arrangement also ensures that the individual does not receive care management from the same agency that provides services. And this ensures that the individual's options or choices of providers are not limited and that they have access to the services from the provider of their choice. This new system of conflict-free care management not only allows individuals to access services from the provider of their choice that truly reflect their interests, but also ensures that the care manager does not have any pressure to refer the individual for services at the agency where the care manager works. Now let's talk about what the transition from MSC to care manager will entail in broad terms. As of now, there are 6 pre-approved, pre-authorized CCOs which have been given the green light to proceed to the readiness review process with the intent to open their doors for operations on July 1st of this year. The big picture is to have each individual's total plan of care coordinated and managed by the care coordination organizations. So this means that each individual's service network will now include clinical, medical, behavioral health, dental, and the traditional waiver services that we all are familiar with, and other long-term supports. This expansion of each individual service network to include these additional services is what requires MSCs to expand their skill set. Each transitioning MSC will expand her or his skill set by being trained on 10 skill building areas to ultimately become effective and responsive care managers. Today, I will introduce those 10 skill building areas and briefly introduce the learning objectives connected to each skill building area. Now, please keep in mind that the care managers are not alone here. They will have a team of nurses and clinicians at the CCO who will assist care managers in monitoring and evaluating the quality and performance of new and existing services, as well as the effectiveness of each individual's life plan. Now we'll discuss some logistics of transitioning MSCs to care managers. OPWDD has decided that all current MSCs will be automatically grandfathered as care managers. And this decision was made to maintain continuity of care and a stable workforce, because we know that MSCs have been the gatekeepers to the system and they will continue to serve in that function. Therefore, the new care manager education and experience requirements will be waived for existing MSCs, and they'll only apply to newly hired care managers. This means that people who have been working as MSCs up until July 1st will not need to meet the new education and experience requirements for care managers. The CCOs will be required to train all transitioning MSCs on delivering the 6 health home core services. As shown on the right side of the screen, the 6 core services that care managers will be expected to deliver are comprehensive care management, health promotion services, assistance with transitional care, individual and family support, referrals to community and social support services, and successfully using health information technology to link and track all services. As I mentioned, OPWDD's upcoming training guide for care managers provides the 10 skill-building areas that all care managers must be trained on to expand their skill set and deliver these 6 core services. The 6 core services that you see are the basis for the CCOs to operate, and while all are equally important, we thought we should highlight some significant changes to family support services as we know it to be a pillar to any successful care coordination and care management system. Now, by enhanced family support services, we mean that care managers will be required to provide more education, counseling, and even training to families and individuals on implementing important health promotion practices, such as supporting adherence to medical and clinical treatment recommendations to help the individual improve on those specific goals, assisting families in navigating and accessing wellness and prevention programs so that families obtain self-help services, peer support, housing, transportation, and respite services, educating families on their loved ones' chronic conditions, conducting medication reviews to ensure regimen compliance, teaching the self-management skills that individuals need on an ongoing basis, and finding the necessary resources so that they acquire and retain those important socialization and adaptive skills that they'll need in their daily lives. Overall, CCOs and care managers will be required to build a more comprehensive network of providers for each individual that may include services outside of the current OPWDD network, like those medical, clinical, and behavior support services. Now, in the transition to care management, the push is really towards closer monitoring and evaluation of the individual's treatment and care needs from the point they enter the OPWDD system through treatment care transitions, supporting the individuals to develop and shape the lives they want, to terminal care. It is clear that some of these functions are very familiar to current MSCs, and as such, some MSC responsibilities will remain unchanged. But rest assured that the care manager will remain a vital team member in each individual's circle of support. Person-centered planning and providing informed choice are what bridges care coordination to care management. And this is why the following overarching responsibilities, MSC responsibilities, that come directly from OPWDD's MSC vendor manual are not going anywhere. So both newly hired and transitioning care managers will still need to help the individual make informed choices, ensure her or his health and safety, focus on the individual's aspirations, and assist in achieving personal goals and now medical and clinical goals. Care managers will continue to promote self-advocacy, self-determination, and community inclusion. The individuals and their circle of support satisfaction with all services will remain an absolute priority. When designing the life plan, care managers must understand and apply person-centered principles. Life plan meetings will continue to be conducted on a semi-annual basis. All care managers will continue to need effective communication skills to successfully expand the individual's provider network and continue developing natural support, but also to successfully negotiate and resolve conflict, especially those having to do with benefits and entitlements. Now, as far as documentation, up-to-date record keeping and contemporaneous documentation will continue to be required. And as you know, the guiding document for all services in the new system is going to be the life plan, for which a separate webinar was held and is available on the OPWDD website. I encourage you all to review it. Now I'll introduce you to the 10 skill building areas from OPWDD's upcoming training guide for care managers. And I'll also show you a sample of the learning objectives that correspond to each skill building area. Please keep in mind that these are the areas of expertise that will prepare care managers to successfully deliver very important outcomes like transitioning each individual's care through any changes in the life plan and any transitional stage in the individual's life, avoiding preventable emergency department visits and hospitalizations, integrating medication and all other medical and clinical treatment regimens, and successfully using electronic health records and health information technology to avoid fragmented care. These are ultimately some of the most important outcomes from an effective care management team at the CCO level. The 10 skill building areas begin to expand the care manager's skill set so that each care manager can successfully deliver these outcomes and the 6 health home core services that we discussed earlier. But thankfully, most MSCs already have the skill set to fulfill most of the learning objectives written for these 10 skill building areas. The first 5 skill building areas are person-centeredness and communication, relationships and communication within the care coordination team, community orientation, cultural competence, and understanding developmental disabilities, chronic diseases, and social determinants of health. And next, you'll see the learning objectives that correspond to each skill building area. The learning objectives are essentially tasks that the CCOs will expect care managers to complete. Please bear in mind that this is only a sample of the learning objectives for each skill building area. And what I mean is that all 10 skill building areas have more than just the 2 learning objectives shown here, but we wanted to give you a feel for what kind of tasks the care managers will be completing throughout their training. OPWDD is giving CCOs the freedom to choose the number of learning objectives that they will expect their care managers to complete. All learning objectives are written as tasks in order of difficulty. Care managers begin each skill building area by first being able to define and explain specific terms and concepts. Then a skill building area is set to be complete when a care manager can go from defining and explaining to applying and practicing specific technical skills. Now, for example, for the second skill building area, relationships and communication within the care coordination team, the learning objectives first expect the care manager to be able to define interprofessional collaboration and then apply mediation skills to minimize care team conflict. Now, there are several learning objectives between these 2 tasks that will take the care manager from, again, defining and explaining or identifying to applying, practicing, or implementing. In the third skill building area, community orientation, the care manager is first expected to be able to describe current transportation resources in New York State before they're expected to actually begin linking the individual to employment services using those transportation resources described. Now, moving on to the second set of skill building areas, we have community supports and services, new models of care and healthcare trends, ethics and professional boundaries, quality improvement, health information technology, and documentation and confidentiality. Here I'll highlight quality improvement and health information technology. Looking at quality improvement, a switch from quality assurance, a care manager is first expected to be able to explain the importance of measuring quality and maintaining data integrity. And then the care manager is expected to be able to implement systemic improvements and corrective actions. Like in all other skill building areas, the learning objectives gradually take the care manager from understanding basic quality improvement concepts through implementing effective quality improvement strategies. Now, for care managers to do quality improvement successfully, they will need to understand the definition of quality and how quality improvement is outcome-driven, while quality assurance is process-driven. And the CCOs will use these learning objectives written in OPWDD's training guide for care managers to develop the necessary training materials and train the care managers on all skill-building areas. Now looking at health information technology, Two of the learning objectives in this skill building area require care managers to first summarize the basic concepts of health information technology, or HIT, and explain how HIT influences care management. So in our case, this really refers to how health information is managed between individuals, families, care managers, all service providers, and the care coordination organizations. Then the care managers are expected to be able to explain the basic concept of health information exchange, which refers to how CCOs and care managers will exchange each individual's health information through different software systems while maintaining confidentiality. Again, the care coordination organizations will have the freedom to create the training materials using these 10 skill building areas and their corresponding learning objectives. Now this brings us to the final portion of today's discussion. There are existing training materials that speak to a few of these skill building areas and that are already being provided by OPWDD. The trainings listed in this table are OPWDD trainings that apply to all care managers, both transitioning and newly hired by CCOs. As you can see in the first row, OPWDD's PRAISE curricula, as well as Foundations of OPWDD, apply to Skill Building Area 1, Person-Centeredness and Communication. OPWDD's Choking Prevention and Tuberculosis Control are trainings that apply to the 5th Skill Building Area, which is Understanding Developmental Disabilities, Chronic Diseases, and Social Determinants of Health. The existing trainings for Benefits and Entitlements, Personal Allowance, SNAP, Liability for Services, and Services for Willowbrook class members apply to the 6th Skill Building Area, which is Community Supports and Services, New Models of Care, and Healthcare Trends. Finally, OPWDD's Fire Safety Training Curriculum that you see hyperlinked in the last row will continue to serve as training for proficiency in Skill Building Area 8, Quality Improvement. It should be noted that some trainings listed in this table are still under development at OPWDD, such as the one in the first row, Foundations of OPWDD Training Curriculum. I do emphasize that these are not the only trainings for care managers to be proficient in all 10 skill building areas. CCOs can use the resources provided in OPWDD's training guide for care managers to develop training materials for all 10 skill building areas. CCOs will have the freedom to select the number of learning objectives that they will expect their care managers to complete, and care managers will be trained on all 10 skill building areas by completing the number of learning objectives selected by their CCOs. The ultimate goal is to take this opportunity to expand the MSC skill set in order to successfully transition into a care management environment and deliver the 6 health home core services. At this point, I'd like to thank you all for welcoming the NIAMP team and allowing us to introduce you to the skill set requirements for care managers as we continue to transition from care coordination. We do know that MSCs have been the backbone of our system, and we are absolutely committed to supporting you during this transition. Thank you for your many years of services, and we look forward to our work together for the years to come. Finally, please welcome Dr. Elizabeth Corrigan and Dr. Gilbert Lewis, who are also part of the NIAMP team and will be helping with answering some of your questions. Once again, thank you.
Thank you, Noelia. We appreciate that presentation so very much. I'm going to pause for a moment and see if we have any questions from our online audience that we want to put forward. So one of the questions, or a few people have come up, put in questions to clarify on what the expectation is for when the training needs to be completed and how individuals will be evaluated, as well as access to the manual.
Good, great question. So I think first of all, to respond to that, just to sort of put this in context, and by the way, this is Kate Marley from OPWDD. The training guide that we're talking about is actually really a guideline for and a resource, an important resource for the CCOs to then develop training and to look at how they best deliver that to their workforce. So it's not actually a training guide or a training manual for MSCs directly, but it is guidance and resources and learning objectives around which CCOs themselves will develop training. And I think as was stressed here, that's important that there is a lot of expertise within our MSC community that we believe staff will bring to the CCO Health Home services. So what will be required for one person will probably be very different than what might be required for another based on the expertise experience that each Medicaid service coordination person brings with them. The other thing the other concept here that I think is very important to really put forward and was mentioned here, but I just want to amplify a bit, is we're really trying to move away from the assurance model to a performance model and to an outcomes model. So what that means is it's much less, check the box, did you participate in 2 hours of training related to person-centered planning, let's say, but much more is the workforce delivering the kinds of outcomes that we want for people, and that's how we're evaluating the effectiveness of the training. So if the training is good, the workforce is delivering better outcomes and has better knowledge and is more confident in the delivery of their services. That's really where we're trying to move toward as a system. And so this training guide really kind of, I think, provides those resources to the CCOs to help them and to help all of us move toward a more outcome-driven system, ultimately for the betterment of services to the people we serve.
Thank you, Kate. One of the other questions that somebody was looking for clarification on is if care coordination organizations are not-for-profit or if it can be a for-profit entity.
Sure, that's a good question too, and we often it can be a bit confusing because it's not that easy. So bottom line is CCOs are organizations that are led by not-for-profit organizations with a history of serving people with developmental disabilities. Their corporate structure can be for-profit. That's simply because, there's some administrative ease in organizations that are these kinds of collaboratives to be formed under that structure. But the important thing, I think, is that they are led by individuals and organizations that have a history of serving people with developmental disabilities and a commitment to this field, and really understand how we want to move this system forward to the betterment of folks that we serve.
Thank you.
Oh, there is one other thing I just had to jump in here, since I think it might have been asked, or people might be thinking it. I do want to just stress that these are not day one expectations. There certainly are going to be some things that are going to have to be learned and understood for day one. But really what we're talking about here, again, and this goes back to the theme of we're trying to move toward an outcome-driven system. We are looking at these as not day one objectives necessarily, although there will be some elements that may need to be day one. And in the transition plan, which has been out for public comment, which talks about the transition from Medicaid service coordination to health home services, we did outline that there would be a period of time where CCOs would begin to work with the staff and assess the training needs and begin the delivery of those needs. So we certainly have allowed that there will be a period of time to achieve some of these learning objectives. And again, just like our services are person-centered, so is the training. So what a staff person needs to participate in is going to be driven by their interests, the people they serve, the needs of those people, and the experience and the expertise that they bring to the position, which can be in a workforce as large as our Medicaid service coordinators can be very varied.
Hi, this is Diane Hank. I'd like to also chime in to expand a little bit more on what Kate said, referencing what would training requirements be prior to July 1, and I know that's a very relevant question for any current MSC. We are currently working with the CCOs to determine what information you would need before July 1. What are their day one expectations? And if you can tune into the next webinar on the 28th and then thereafter, we should have some more specificity, but we are trying to determine what's really essential in terms of being able to report to work on July 1 and make that accessible and manageable for all the MSCs who are transitioning. So just keep in mind, I want to reassure people that there's not, a whole new huge swath of trainings. Basically, we are counting on the fact that our MSCs bring to the job a lot of the skills, just as Noelia referenced, that are part of the 10 skill building areas, and that puts us at a great advantage as opposed to starting from ground zero and not having any of that background. So more to come on that information, but I just wanted to let you know that we're working to develop that and make it accessible and also manageable for any transitioning MSCs.
The last thing that we'd like to add is that this presentation and the recording of it will be available on the OPWDD website. I would say in about a day or so. We need a little time to get it up, but it will be available.
Very good. Well, then I guess that wraps us up for today. I want to thank you all again for joining. Please share the WebEx information with your colleagues because we want to extend this information as far and wide as possible to make for a smooth transition for everyone you support as well as for all of you. So please tune in again on February 28th. Thanks again and have a good day.